different than your common carotid artery. Your common carotid artery, when that's lacerated, that can very quickly become a fatal injury. So we brought him to Buffalo General Hospital as fast as possible. I had one hand on his neck the entire time, controlling the bleeding. The other hand, I'm feeling his radial pulse, just to make sure that he isn't going too fast and that he doesn't lose his radial pulse, which would be a sign that his blood pressure is dropping. He was awake with me the entire time. He was very cooperative. He understood that we were doing what we had to do. The EMTs were establishing IVs and putting fluid into him as fast as they can, putting oxygen on him, and we took him directly here and turned him over to the care of the people at the emergency room.
I'm Dr. McCormack. I was working in the emergency room last night. We were first alerted about the injury by one of the staff members who was on break and was watching the game and came running out and said there was a player with a devastating injury. You could tell it was arterial just on the TV. And so we started to get prepared. Very soon after, we got a phone call from one of the physicians at the game, a Sabre physician who called us to tell us that it was a carotid injury and that he'd be coming in. So at that point, we kind of prepared as we could. We had the staff ready. We notified the blood bank to get us blood to the emergency room. And we called the surgical team, including Dr. Noor, and informed her of what we were expecting. Very soon thereafter, the ambulance arrived with Richard. He was brought into the resuscitation room. He was looking at us, awake. He had some trouble speaking at that point. Dr. Bassam was applying pressure to his neck, and he clearly had swelling at his neck from bleeding that was going into the tissues as well as coming out of the wound. He seemed to understand what was going on and was following commands and was able to utter one or two words at that point to direct questions. At that point, the surgical team arrived as well. We were able to get a better look at the wound and get some control of the bleeding by applying direct pressure to the artery itself. It was clear that it was an arterial injury. We didn't know if there was also a venous injury at that point. We became concerned. He was clearly in shock from blood loss. His blood pressure, his heart rate was high, his blood pressure was a bit low. We were giving him fluids. We already had blood in the emergency department by the time he arrived, so he was immediately being transfused. But we became concerned of his ability to breathe because of the swelling in his neck, and he seemed to get less responsive and have more trouble speaking. So at that point, we medicated him, sedated him, and passed a tube to assure that he would be able to breathe. We intubated him and placed a tube in his trachea. We had good control of the wound at that point. He was getting blood, his airway was secured, and so he was taken immediately to the operating room. And that's where Dr. Noor.
So I'm Sonia Noor. I was the vascular surgeon on call last night. Dr. Kroll was actually at the game, and since he was there, I asked him to come in and give me a hand. I think Dr. McCormick very expeditiously protected the airway, was able to get a breathing tube in, and we took him upstairs to the operating room. Very quickly, between Dr. Kroll and myself, we were able to actually find the artery, and what it had done was transected, not quite completely, but just hanging by a thread. And it's critical to us that that actually happened and it wasn't completely cut in half, because then it would have retracted. It would have been even more difficult to get control. So quickly we were able to control that, bring the two ends of the artery together, and for once it was a nice, clean, beautiful artery, which is not what we're used to as vascular surgeons. But we were able to repair it, and our carotid clamp time, which sort of indicates how long you can have brain injury or ischemia if it's clamped off for long, was very short. And I think that's indicative this morning that he's awake, he's alert, he's oriented, and he can talk to us. Our second concern was if he had any other injury, if the skate had either pierced the esophagus or the larynx. And we did have Dr. Muscarella come in, who was an ENT surgeon, who scoped him, and there was no further injury. So what was left then was the head, or if there was any cranial nerve injuries in the neck. Just a picture here to show you what this looks like. If that's the picture of the neck, that's the vein, the internal jugular vein. The common carotid artery is right next to it, and then you have a bunch of nerves right next to it. And the common carotid artery was the only artery that was injured. It was actually sliced right about really at this level, 3/4 of the way, and just with the thread hanging on. So we were able to repair that, as I said.
Can you tell us, will he make a complete recovery?
Well, that's difficult to say. So far, he looks very good. He's complete, alert, awake, oriented. He remembers what happened last night. He remembers the pressure on his neck he was complaining about. But this morning, neurologic function-wise, he's right on target. His CT scan of his head shows no further injury. And whether he has some nerve injury, which would have been, small comparatively, may or may not be there. He actually asked me when he can go back to training. I said next season.
Is the tube out? The breathing tube?
Yes.
Is he able to talk?
Yes, and he's really not very hoarse.
For some perspective, if this had been, I don't know, a high school hockey game or a college hockey game without a doctor right there, would he have made it?
I think what happened to his survival was what the initial care he received was critical to the good outcome. I mean, it's hard to say what would have happened under other circumstances, but clearly the care he got initially by the staff at the arena, I think, saved his life. There's no question about that.
He had the presence of mind to hold his neck, and then I think Dr. Pasan did an awesome job just controlling the bleeding. Of course, the EMT guys, the ER securing the airway, but it took all of those steps. Our techs, our nurses upstairs on the floor, just wheeling them up in there, and then us to be able to do that with anesthesia and the blood bank available. This is otherwise a fatal wound.
John?